Chapter 8, page 235. Reading: The New Science of Mind and Body. The relationship between emotions and health is turning out to be more interesting and more important than most of us could have imagined. Viewed through the lens of 21st century science, anxiety, alienation, and hopelessness are not just feelings. Neither are love, serenity, and optimism. All are physiological states that affect our health just as clearly as obesity or physical fitness. And the brain, as the source of such emotional states, offers a potential gateway to countless other tissues and organs, from the heart and blood vessels to the gut and the immune system. Modern life is rife with potential stressors, and there is now little question that uncontrolled stress can kill. Experts now believe that 60 to 90% of all visits to the doctor involve stress-related complaints. As researchers chart the effects of hostility and hopelessness, they're also gaining insights into the mind's power to heal. Can we teach ourselves to be healthier? That is the central question of mind-body medicine. Stress-related illness often defies conventional remedies, and when we try to heal these illnesses with high-tech pills and procedures, the costs of treatment can easily outweigh the benefits. Mind-body medicine offers a saner starting place. It could reduce medical costs while improving our health and our lives. And whatever its limitations, it has the advantage of doing no harm. We all need a dose of the doctor. You're the doctor. Your patient feels ill, but you don't have anything curative in your medicine bag. What do? That question has long stymied physicians. A founding insight is that patients who have a good and trusting relationship with a clinician are more satisfied, and satisfied patients get better clinical results. They're more motivated to take care of themselves, more comfortable seeking help when problems arise, and more willing to follow advice and take medication as prescribed. The medical profession is struggling to revive the healing relationship. The medical schools at Harvard, Columbia, Duke, and the University of Arizona have all created programs intended to pull medicine away from an exclusive focus on disease and toward the promotion of wellness, stressing the doctor's role as partner, teacher, and coach. And at least 2/3 of all U.S. medical schools now devote some part of their curriculum to integrating conventional and alternative therapies that patients find more friendly. With the right reorganizing of priorities, the system can cultivate a deeper personal role for physicians. For a happy heart. The Japanese have a word for it, karoshi, or death by overwork. But can stress on the job really do you in? It should come as no surprise that emotions affect the heart, and not only in metaphorical, symbolic terms. Suffer a fright, and your heart begins to pound. Get angry, and your blood pressure rises. In a major study in The Lancet, researchers surveyed more than 11,000 heart attack sufferers from 52 countries and found that in the year before their heart attacks, the patients had been under significantly more stress from work, family, financial troubles, depression, and other causes than some 13,000 healthy control subjects. Severe stress didn't pose as great a risk as smoking, admits Dr. Salim Yusuf of McMaster University, senior investigator on the study. But it was comparable to risk factors like hypertension and abdominal obesity. That's much greater than we thought before. If there's a common explanation, it may lie in the stress response. The classic stress condition is the fight or flight syndrome, which primes the body to flee from an attacker. the heart shifts into high gear and blood pressure rises. Platelets in the blood become more sticky to aid clotting in case of a wound. That's perfect for a zebra sprinting from a lion. But when the body responds the same way to everyday stressors, the cardiovascular system suffers. The implications are dramatic, not only for our risks of developing heart disease, but also for treating it. Stress reducers like yoga, meditation, and group sharing have direct effects on cardiac risk, lowering levels of stress hormones and helping to relax arteries. They also have indirect effects. Participants gain a sense of well-being that helps them stick to a diet and exercise plan, and they have each other for support. Combination therapy. These days, tens of thousands of cancer patients are using mind-body practices like relaxation, talk therapy, music therapy, visualization, Tai Chi, and prayer to help them deal with their disease. 80% of cancer patients report using some kind of complementary medicine, a category that includes mind-body techniques, as well as nutritional supplements and other holistic approaches. And no wonder. Scientists have found that mind-body practices help patients sleep better and cope with the pain, anxiety, and depression often associated with traditional cancer treatments. Recent research has shown that mind-body practices can subtly enhance a cancer patient's immune system too. Although many of these techniques have been around for thousands of years, scientists have only recently been exploring how they can be used in the fight against cancer. In a 5-year study published in the New England Journal of Medicine in 2001, doctors at the University of Toronto found that breast cancer patients who attended weekly support groups and talk therapy, in addition to undergoing conventional chemotherapy, reported much less anxiety and pain than patients who went through standard treatment without such help. Repeated studies have shown that conscious relaxation and meditation can counteract stress by lowering heart rate and blood pressure and reducing levels of the stress hormones cortisol, epinephrine, and norepinephrine in the bloodstream. They also enhance immune function. In a published study, researchers at the Ohio State University Comprehensive Cancer Center observed 227 breast cancer patients for 10 years. Scientists found that the patients who received regular relaxation training and attended therapy in a support group had higher T-cell function than those who didn't participate in mind-body training. 3 simple ways to reduce stress. Meditation. Choose a short phrase or prayer that is rooted in your belief system, such as peace. Sit quietly in a comfortable position and close your eyes. Relax your muscles, progressing from your feet to your calves, thighs, abdomen, shoulders, neck, and head. Breathe slowly and naturally, and as you exhale, say your word or phrase silently to yourself. Ideally, you'll continue the exercise for 10 to 20 minutes, but even 5 minutes of deep relaxation can leave you calm and refreshed. Paced respiration. Start by inhaling slowly. As you exhale, say the number 5 silently to yourself. Breaths should be deep enough to cause the belly to expand fully. After pausing briefly, take another slow breath and think 4 as you exhale. Continue at your own pace, counting down to 1. Repetitive activities. You don't always have to sit quietly to evoke the relaxation response. You can do it while walking, jogging, playing a musical instrument, or carrying out simple repetitive tasks such as knitting. Yoga, Tai Chi, meditation, and repetitive prayer are other ways to put yourself in this healthful frame of mind.